Good day to all. This video is designed as an overview of the HII Impairment Index or HII score. This assessment tool is designed to evaluate alcohol-impaired patients. The aim of this pilot project is to validate this tool in the pre-hospital setting and determine if it can be done safely and accurately by EMS personnel. Over the next few minutes, we will discuss what is the purpose of the study, how to fill out the form, and how to perform the HII Impairment Index assessment tool on a patient. At the end, you will watch a brief clip of a provider performing the HII Impairment Index on a simulated patient. The HII Impairment Index, or HII score, applies a numerical value to the degree of alcohol-induced impairment in a variety of activities or observations. It is used to aid in clinical decisions regarding a patient. It has been used in the hospital setting since 2017, and it takes 3 minutes or less to perform, since part of the test is done normally in any EMS patient encounter. A normal score is 0, with the highest score being 20. The purpose of this pilot is to validate the HII Impairment Index assessment tool on pre-hospital patients suspected of alcohol impairment. We hope that by validating this tool, we can incorporate it in our decision-making process to decide if patients under the influence of alcohol can safely refuse transport. EMS personnel will apply this assessment tool to any patient over the age of 18 suspected of alcohol impairment, regardless if they are transported or not to the hospital. This tool will be done in parallel with our normal procedures and will not be used at this time to make clinical decisions. You will continue using protocol ASP11 for patient refusals as always. This is the HII score form that you will fill out for all patient encounters with suspected alcohol impairment over the age of 18. EMS personnel will fill out the form, but will only include the date of incident, time of day, and the incident run number. After completing the HII assessment tool, they will annotate the total score in the top right corner of the form. This form will be forwarded to the EMS division through fax, email, or drop off at the emergency department drop box at the entrance. When assessing gross motor function, you will look at a couple of things. Does the patient have a steady gait when walking? This would be a score of 0. A score of 4, on the other hand, would be a patient that does not cooperate at all or move on its own. When assessing speech quality and content, you will ask the same questions as you do when assessing orientation. You will pay attention at their speech pattern and assess if it is slurred or not. Does it make sense to you? Are they just unable to talk or just doing incomprehensible sounds or moans? When assessing finger tracking and nystagmus, you will ask the patient to follow your finger with their eyes. Nystagmus is an involuntary, rhythmic, side-to-side, up and down, or circular motion of the eyes that occurs with a variety of conditions. In alcohol impairment, the nystagmus is side to side when present. When assessing target touching, you will have the patient touch the tip of your finger with the tip of their finger. A normal patient will be able to do this in a single, steady movement. In the last assessment, the patient is required to trace a line between two curved-like lines. A normal patient will be able to trace a line without touching the borders. As the patient is more impaired, it becomes increasingly more difficult. In the next slide, you will see a video of a physician performing a HII score assessment on an impaired patient from start to finish.
I'm Dr. Berger. How are you feeling?
I'm okay.
What's your name, ma'am?
My name's Carol.
Okay, and where are you right now?
Hospital.
Okay. All right, Carol, I'm going to ask you to do a few things for me, if that's okay. All right, can you just go ahead and touch my finger with your finger? See this finger? Just go ahead and touch it for me. Good. All right, Carol, thank you. I want you to also look at my finger. Let's bring it all the way over here and just kind of watch my finger. Okay, good. Carol, next thing I'm going to have you do is try to draw that line for me through these curves. Can you keep your pen within the curves of that line for me? Go ahead and try to draw it for me. All right. Good job, Carol. I'm just going to ask you lastly to just, can you sit up for me in bed? Excellent. Now, Carol, do you think you could just swing your legs over and stand up for me? Think you could stand? Okay, great. Go ahead and lie back down. Thank you, Carol. Good job.